So dear students, today we'll discuss about a trauma, a brief topic that is penetrating wound. That's very common. Look at this. See that? So that is a stab injury with a knife or sickle, whatever it is. See that it's gone deep. There is a clot here. See that? It is in the right iliac fossa actually, like a surgery incision it is. So it is penetrating wound in the abdomen, usually caused by a stab, like this, or sickle or stab. So features are common in the chest and abdomen, may be associated with the vital organ like liver, in the upper abdomen liver. Here it may injure cecum, it may injure iliac vessels, it may injure ureter in this area. All those organs which are there in this area, it may injure. May present the shock, bleeding. There are major vessels injury is there, shock, hypertension, distension of the abdomen. You can see here clot here. So all these wounds should be explored, whether it is patient is hemodynamically stable also. You can't just suture and come out under local anesthesia. You have to shift the patient in OT, under anesthesia, explore it. Many times you will see that only abdominal wall is injured, some vessels in the abdominal wall, like maybe branch vessels, more medial, maybe inferior epigastric artery may be injured. If you ligate that one and put a very good thorough warm saline wash, put a drain and close the wound, it is sufficient. But may not be so many times because it may be deeper wound. There may be injury to the cecum or ileum or vessels or ureter, which may not be noticed. It might small clot as far might have sealed up that point of time. So always explore properly entire abdomen and then close the wound. There's the dictum. Never close just like under local anesthesia. Always do it in the OT with the formal anesthesia, with the former preparation and keeping ready everything. There is a point which is very, very important in such patients. That's why this penetrating wound is very important. So ultrasound chest is important. Fast you can do, abdomen, rule out organ vascular injury, wound explosion anesthesia, blood transfusion if you think that hemoglobin is dropping and patient is hemodynamically unstable, and repair the injured vessel or organ. Depending on situation, take a call what exactly you want to do. Ileostomy, suturing of the bowel, or repair of the iliac vessels, or organ injury there, suture the organ, put a pack and so on. Depending on the criticality and situation, you take a call actually. Either initial such situation you may do a life-saving procedure, and later procedure you can do later. So answer the MCQ. A 20-year-old male was brought to emergency with a stab injury abdomen. His pulse is 120 per minute. BP is 97/60 mm mercury. What is the management? Wound debridement suturing, exploratory laparotomy, wait and watch, wound dressing. So put the right answer in the comment box. I'll get back to you. So students, go through my SRB's clinical methods in surgery, which has got a video lectures of each topic. So many topics are covered. Every topic as far as CBM syllabus is covered. How to examine the patient. Swelling, ulcer, arterial disease, venous disease, thyroid, breast lump, mass abdomen, briefly orthopedic, every system, whatever your required thing, everything is covered. There is a video of how to examine of each topic, and principles of examination is good, and differential diagnosis in the table format is given, and briefly investigation. Suppose treatment is not a topic will be covered in a clinical method examination, remember, and many photos of the most of the conditions with the illustration. Photos will tell the clear idea about for the students how exactly condition looks like. So covers everything with the beautiful photos, and it also gives the instruments, specimens, then operative surgery briefly. Everything is covered. Small images also it is covered. So it is more than sufficient for all undergraduate, postgraduates of any system to learn very basics. Is the required thing for the surgical field is clinical methods. So please go through that and purchase that and make use of it. My SRB manual of surgery is very popular. It covers theoretical aspect, everything, principles, treatment in detail, briefly technical aspect, and with the photos, illustrations, quotations, all topics with the specialty, urology, cardiothoracic, neurosurgery, and operative surgery instruments. Again, it is covered in this book also. Every quotations, and you should worldwide also, actually including our country, everywhere. And please, you can make use of it. My operative surgery book, SRB's operative surgery atlas, that is a 2-volume book, covers in detail operative technique of surgery, all surgery, small surgery, major surgery, everything, with around total around more than 10,000 illustrations and photos. It gives very good principles and technical, step-by-step technical aspect. Very, very useful for postgraduates. But not much useful for undergraduate, but it's a postgraduate book and consultant book and learner after MS. It gives everything. You can, before going to surgery, you can always read this book and have memorize your steps and do the surgery properly. Every topic, general surgery, gastroenterology is covered in detail, step by step with illustrations. And my SRB is Atlas of Tissue Approximation, small book atlas, 100 pages, how to do the suturing, tissue approximation, including laparoscope suturing with the video. It is covered. So any basic learners, suturing is very, very important surgical field as a skill actually. Dissection and suturing, so the two parts of the surgical skill. So that is also covered very well with videos. You can always go through that. And my website, please subscribe, all of you. If your daily lectures are there, live sessions are there. My Digihour lecture through JP Publishers, around 220-hour lectures. Entire thing as for CBM is covered with the examination part, with all topics of CBME, ulcer to operative surgery, instruments, specimens, examination, specialties, basic, everything is covered. You can always purchase for 1 year and have a clear idea about the surgical topics, understand very well and helpful for your exam, NEET, MCQs. Also, it is there both in manual and my lectures. So students, I hope you have understood this lecture very well. Thank you very much.